Thanks, Sam. As COVID cases continue to rise here in Connecticut, we know there are some people who may be putting off checkups or health screenings due to the virus, may be nervous about going into a healthcare setting, but doctors warn that could be setting them up for bigger issues down the road. Joining me now is Dr. Kenneth Weisman, a board-certified urologist with Hartford HealthCare Medical Group. Doctor, welcome.
Well, thank you. Thank you for having me.
Thank you for being here. So what are you seeing from patients during this pandemic?
Oh, we're seeing a lot of patients during the pandemic. In fact, our numbers are higher now of office visits than they were pre-pandemic. The visits are different. We do have to socially distance. We all wear masks. We may have a face shield. You need a temperature taken to come into the building. Not everybody is comfortable with even those measures. Certainly, I feel safe. I'm in a high-risk group, but not everyone does. People may have issues, health issues, previous issues, and they don't really want to have to deal with COVID. So we have virtual visits where people can stay at home and meet us on the computer.
All right. What if someone is having a health issue? Can they still have a virtual visit?
Oh, absolutely. The health visits are very much like a visit that we would do right in the office. It starts off with a little history, and using the camera on the computer, you can even examine someone somewhat superficially, but you can make plans, you can order tests, you can order x-rays, and then you can do a follow-up.
Okay. All right. For men, what are some signs or symptoms that indicate there is a problem that needs to be addressed by a doctor?
Well, certainly in urology, any kind of voiding problem, this time of year, people tend to get up more at night. You know, it's cold. You have to go a little bit more urgently. But sometimes it's a little bit more than that. And we don't really want to put this kind of stuff off. You get a window. COVID started last March, and it may not be over before this March, so you don't always have that 1 year grace period. You want to get on it and not make little problems into big problems. Certainly if you're having pain or any kind of bleeding, you know, these are not things that you should just let sit.
Okay, and Doctor, finally, you have an upcoming virtual education class that's free, and if anyone has some health concerns, that may be a good way to get more information. Tell us about that.
So on the 15th, it's at 6:30, a virtual education. It's just like being in the auditorium. You can ask questions. The topic is going to be prostate problems and fixes. So we'll go over the treatments. We'll go over the, what you do for each thing and what to expect. All
right. More on hartfordhealthcare.org. Dr. Kenneth Weisman, thank you very much for joining us. Good information.
Thank you.